Hi everyone, and welcome to Module 8. This week we'll be taking a look at women's mental health and human rights. Here's what you'll be doing this week. By the end of the module, you'll have the opportunity to analyze socio-ecological factors that impact women's mental health. You should be able to explain gender differences in terms of mental health outcomes. You'll examine factors that impact well-being for special populations, such as refugees, immigrant women, and women and girls with mental disabilities. You'll also critically appraise international efforts to improve mental health and human rights for women, and you'll complete tasks related to your course project, which is due in week 9. As mentioned, some of the topics are as follows. We'll look at why mental health is a human rights issue, and you'll have the opportunity to read several chapters from the book on mental health and human rights by Dudley. Those PDFs are actually attached in the module. We'll look at gender differences in mental health and human rights, again, refugee and immigrant mental health. There's a case study relative to women with mental disabilities in India, as well as what the response for Human Rights Watch, which is a nonprofit and non-governmental group, is to these injustices and their draft of recommendations to CEDAW. And you'll take a look at some other international efforts to address mental health and human rights. I just wanted to take a minute to highlight some of the key issues that we'll be talking about this week. First, when we look at gender differences in mental health outcomes between men and women, you'll note that unilateral depression is by far more commonly diagnosed in women than it is in men. However, when we look at severe mental illness, we see that rates of schizophrenia, bipolar disorder, those we see no gender differences. So when we're looking at issues such as anxiety and depression and post-traumatic stress disorder, we actually see those more diagnosed in women. Also, we're seeing that prevalence rates for any kind of psychological disorders are increasing. And that could be, of course, because there's more diagnoses of mental health disorders than in the past, but also we know that there are other stressors. So those rates are actually increasing. Also, mental illness among women, and men for that matter, usually goes undiagnosed. In fact, according to the WHO, many who need mental health care often do not seek it, and less than half of those with diagnostic criteria for psychological disorders are identified by doctors. And don't forget, of course, that access to mental health care is a huge, huge issue, and it's one that has been called out by the WHO, the need for community-based mental health interventions and care is dire. And some of the facts that are mentioned on the slide, I already mentioned, but I want to talk about some of the socio-ecological factors that are related to why more depression and post-traumatic stress disorder are actually diagnosed in women. First of all, we know that women are more likely to seek care and seek help for this, but also consider, when we look at the bigger picture, that women and children are 80% of the 50 million people who are affected by armed conflicts, natural disasters, and displacement. And at least 1 in 5 women suffer rape or attempted rape. Also we look at poverty and the stress that causes. There are more women and children living in poverty than men. And also in certain areas of the world, we see more women are head of households. So there's a number of socioecological stressors that play into why there are more of these mental health and diagnosed psychological issues among women. Also biology, and can't forget that. I just wanted to bring your attention to an upcoming Women's Global Health Live webinar that will take place in Module 9. It's with Dr. Vicki Breckwith-Vasquez, and she will be presenting on the topic of sexual harassment and abuse in the agricultural industry, especially among Latina migrant women. So you won't want to miss that. Dr. Vasquez is also leading an initiative with the nonprofit Oxfam to look at how her research has implications for policy and addressing these issues. So your assignments for Module 8 are as follows. First, you'll take a Module 8 quiz, and then you'll have the rest of the week to finish up your final project, which is due at the end of Module 9. So you'll want to take a look at the rubric that was included in your syllabus. You'll be writing a reflective response paper about your project and your experience and what you've gained, as well as providing some evidence of your project, and that can take various forms depending on what project you chose. You'll also have the opportunity to complete a self-evaluation on yourself, as well as your peers if you worked in a group. So take a look at that rubric that's included in the module or in your syllabus, and let us know if you have any questions, and we look forward to seeing you in Module 8.